At the time of clinical diagnosis, patients with Parkinson's disease already have a wide range of motor and non-motor features that affect their daily functioning. However, the temporal sequence of occurrence of these features remains largely unknown. We studied prediagnostic trajectories of Parkinson's disease patients during 23 years before clinical diagnosis. Our study was embedded within the prospective Rotterdam Study, which has followed close to 8,000 community-dwelling individuals, aged 55 years and older. The study started in 1990, and at baseline, all individuals were screened for Parkinsonism. For our current analyses, we excluded persons with prevalent Parkinsonism. Between 1990 and 2013, the cohort was invited to our research center on average every 4 years, and during these visits, our team conducted standardized assessments of daily functioning, motor features, and non-motor features. In addition, the cohort was continuously monitored for onset of clinical Parkinsonism. During follow-up, 109 individuals were diagnosed with Parkinson's disease, and we matched each of these patients to 10 controls based on age and sex. Subsequently, we compared pre-diagnostic trajectories of these two groups. During center visits, we used 2 standardized questionnaires to assess daily functioning in study participants. We observed that from 7 years before clinical diagnosis onwards, pre-diagnostic Parkinson's disease patients increasingly reported impairment in instrumental daily activities, such as shopping and traveling independently. In the last 5 years before clinical diagnosis, these troubles extended to more basic tasks such as eating. Also during center visits, study participants were examined for the presence of Parkinsonian signs. Research nurses, who were repeatedly trained by movement disorder specialists throughout the entire study follow-up, made standardized observations of bradykinesia, hypokinesia, tremor, rigidity, and postural imbalance. We observed that from 7 years before clinical diagnosis onwards, Parkinson's disease patients more commonly showed signs of bradykinesia and tremor. Closer to the clinical diagnosis, these patients showed additional motor features, concurring with their increasing impairment in basic daily activities. Furthermore, patients also underwent cognitive functioning tests during center visits. Strikingly, Parkinson's disease patients showed subtle yet distinct deterioration in information processing speed and executive functioning as early as 6 years before a clinical diagnosis was made. In these patients, memory decline occurred later. Our team also assessed a range of other non-motor features during center visits. These included elaborate standardized questionnaires of anxiety and depressive symptoms, as well as full assessments of current medication use. Most notably, we observed that Parkinson's disease patients increasingly reported anxiety and depressive symptoms, and they also used laxative medication more frequently than controls throughout the pre-diagnostic phase. In conclusion, we observed a broad prodromal profile in Parkinson's disease patients with a remarkable deterioration in the last 7 years before clinical diagnosis. In these patients, impairment in instrumental daily activities appear to predate difficulties in more physically oriented tasks.